You're tuned to Pregnancy, Birth and Beyond. Contemporary conversations where stories, science, traditions and new ideas meet. Our show is coming to you from the studios of Bay FM in Byron Bay and is broadcasting across Australia on the Community Radio Network. You never change things by fighting the existing reality. To change something, build a new model that makes the existing model obsolete.
You know, I had a chance to go in, and on Friday mornings they sit and talk amongst the whole group of providers about all of the patients that are inpatients there and just go through them. And it's amazing because there's a range of doctors, there's GPs, there's psychiatrists, and a range of other specialists. And then there's naturopaths and there's health coaches and there's other types of providers in the room. And, you know, it's very rare, in my experience, to see many different providers coming together and discussing cases in that way.
You're with Annalia Tia. Welcome to this special feature episode of Pregnancy, Birth and Beyond, the changing face of medicine around the world and how Australian physicians and consumers are inspired to ask better questions about our healthcare system. I have been fascinated by and following functional medicine for the past 4 years since I first heard about it, and recently had the opportunity to meet with one of its biggest international advocates, James Maskell. This fascination has opened the door to a wider discussion about healthcare. Medicine and science are evolving at a breakneck speed, and yet chronic disease is on the rise. Global antimicrobial resistance threatens to destroy some of science's most notable achievements, and the cost of healthcare in an ailing and aging society may very well be digging us all into a serious pickle.
For the doctor, there's a large emphasis on the pharmaceutical model within that. And as we know, much pharmaceutical research is done by the pharmaceutical companies that supply the medication. So, you know, there's clear limitations in that. And even we know that there's been research done on the guideline committees, so they're the committees that put together the pharmaceutical guidelines that we're all meant to stick to, that there's been research that's shown in the UK and in the US that on those guideline committees there's quite a large degree of undisclosed conflict of interest. You know, people who've been paid by pharmaceutical companies to do research, people who are linked to pharmaceutical companies. And that there's, even in the mainstream press in the last couple of years, there's been a lot of information about, you know, are these guidelines really, you know, how sound are they and how much should we be using them? And then bring into that the fact that each person's totally unique and each person's trajectory towards an illness has been totally unique. Everyone's genes are really different, you know, and now we're looking at epigenetics, so we're saying, okay, we've got this set of genes, that's interesting, but it's not everything, because those genes, for the most part, are just sit there, they're just like plans, like architectural plans, and so they can't activate themselves. What activates your body to make copies of the genes and for the gene expression is the environment, okay? Yeah. So everybody has a totally unique set of genes, right? And every person has a totally unique set of kind of environmental factors. So that's got to do with their, their antenatal environment. So in utero, it's got to do with the mother's emotional environment. It's got to do with their own emotional environment, any trauma that's happened to them, their physical environment, the now greater than 140,000 chemicals that we're exposed to on a pretty much a daily basis. And so this whole environmental cocktail then influences the gene expression, which we call the phenotype. So your phenotype is your current gene expression as you sit right here, right now, right? And tomorrow your phenotype can start changing because you start eating differently, or because you change the chemicals that are in your environment, or you travel overseas, or whatever. Everything that happens to us or that surrounds us is our environment that determines our phenotype or the expression of our genotype. And so when you're looking at things like guidelines, I mean, they're generic guidelines, right? We don't even know if that person with that illness will respond to that drug in the way that trial said that you might. you know,
yeah.
or that those combinations of drugs aren't going to cause a problem because of some enzymes that do or don't work. You know, certainly limitations in that model.
This two-part article features several trailblazing, passionate figures in the move towards changing the way healthcare is delivered, both globally and locally. The first part looks at some of the overarching issues within the current medical system and the new emerging model of care seeking to correct and create significant primary healthcare reform around the world. We will be hearing from James Maskell, an international speaker, founder of Functional Form and the Evolution of Medicine, and author of a compelling book with the same title. We also tap into the wisdom of Dr. Penny Caldicott, president of the Australasian Integrative Medicine Association and founder and director of Invitation to Health. Championing integrative medicine, Penny walks among those leading a new era in Australian healthcare. Ren Dubois, clinical director of the Health Lodge in Byron Bay, also features discussing her passion, experience, and how she makes it work in her practice. There will be a few extra soundbites from the AIMA conference in Sydney, functional medicine and the micropractice woven into this article. If you have any questions or comments or would like to learn more about the information presented here, please head to our website www.pbbmedia.org.
This is a new company called Verta Health. It launched on the back of a study. It's basically a type 2 diabetes specialty clinic. And while we're all arguing over what diet is the healthiest for type 2 diabetes, they're just doing it. They're not asking for anyone's permission. They're not, hoping that the government will do something to help them. They've raised $37 million, and in their initial trial with reversing type 2 diabetes, 87% of patients reduced or eliminated their insulin. 56% of patients reduced their HbA1c below diabetic level, and 12% weight loss in 6 months.
Things that we would label as preventative are really about screening for disease. Okay, so pap smear, is about screening for disease. And sure, you can use that consultation to talk about sexually transmitted infections and talk to people about contraception and all of that kind of stuff. So, we use more, we do some preventative stuff there. Breast checks, we're looking for cancer, we're helping people to have a kind of idea about, checking themselves and screening. And so a lot of the stuff that we call prevention in medicine, to a large degree, is really about screening for illness. And there's a little bit of education, but real education requires a lot of time. So when we can use the word prevent, I think a lot of integrative doctors and therapists would consider that a lot of what they're doing is prevention, but because prevention doesn't mean so much anymore, because we've used prevention for disease screening, I've been starting to talk about preemptive medicine. How do we get in before you're even needing to kind of screen for things? How do we talk to women about what's going to keep your breast healthy? What's going to protect your cervix? How, if you're in a good nutritional state, that you'll probably, if you've got in a healthy young woman, you've got a 98% chance of clearing the human papillomavirus, which is the virus that is linked to the cervical cancer. So really the preemptive medicine is really about wellness. It's really about helping people to understand wellness. And, maybe, decades ago, we would have understood what kept us well. We would have been, intuitive to know what was going to keep us healthy. And now we have to relearn that. We have to reteach ourselves. We have to relearn it. We have to get away from this kind of huge marketing around us about what about what we should be doing, and get back to a state that's intuitive, because as we were talking about before, each person's totally unique, and so the diet that's going to suit you is going to be different from the diet that's going to suit me, that's going to suit our husbands, our children. We are talking in conventional medicine about individualising care, but I think in integrative medicine we really individualise care. So in terms of more like a definition, it's really about using the best of evidence-based science in medicine to apply to the individual patient on all levels, so on a physical, mental, emotional and spiritual level, so that we're taking into account the whole person as we treat. And so the same person, so a different person with the same illness, you're going to treat really differently.
Yeah.
And they might be totally ready to embrace treatment, they might not be ready at all. You might have to help them to get into a state of readiness. You might start in one person at the biochemical level, you might start someone else with the at an exercise level. You really have to work individually to see what the readiness is.
One of the things about America, why I live in America and why I like to operate in America, is that the system's such a mess that actually it gives people the reason to go out and create the new. Right here, I think and the same in the UK, because there's a sort of a baseline socialized medicine system where everyone can get sort of like baseline healthcare and it's free. Mainly, people are less willing to innovate, and that's not just the patients less willing to innovate, but that's actually the physicians themselves. Like the level of physician entrepreneurship or clinician entrepreneurship, I think is way behind America. There's just not a history of private practice. Maybe doctors come in, they expect to be GPs, they expect to have a job, they expect to be paid. They're certainly not expecting to ever be their own accountant, their own marketing manager, all of those types of things. So, in America you have a history of physician entrepreneurship, and therefore we've seen innovation. Like the functional medicine movement has taken off in America because doctors, once they feel a moral responsibility to actually deliver this type of care, which is more proactive, working with patients on their diet and lifestyle more aggressively, using the lowest cost, least invasive interventions first, which has to make sense from a cost perspective. Once they decide they want to do that, they just go and do it because they can hang their shingle and they can market themselves. And it's been a bit of a mess. Like, I wouldn't say that it's been great success everywhere, but there's just a sort of a culture of I'm just going to go and do it. One phrase that's been mentioned to me a number of times in Australia is this idea of the tall poppy syndrome. And I know about that because I grew up in England, where it's like you don't want to step outside of the norms, and you don't want to sort of do anything radical put your hand up to say I'm doing something different. But I think you're also seeing like an evolution of the culture where people are realizing, okay, chronic diseases are going up. It's costing a lot. Everyone I know has some sort of chronic disease, autoimmune disease, lifestyle-based disease. And so I think there's just sort of like it's becoming less and less socially unacceptable to try something new. And so I see those physicians who are stepping out and are thinking differently and doing things differently are having great success. And I think ultimately, once other physicians see other physicians saying, hey, what's he doing? Like, he seems happy in his job. He seems to be enjoying his interaction with patients. I think, you'll see the quickening.
So when patients call up and they're not really sure where to start, the recommendation is they get an appointment with me as the clinical director. I take a case history and I get a little idea of where the patient might be at. And I make a plan with them. It seems like the best place for you to start is just with some craniosacral therapy and some acupuncture. Let's see if we can bring the nervous system out of fight or flight. The patient will go, yes, that's where I want to start. Or they'll go, no, I've done that work. I just want to focus biochemical. So I'll put the suggestions on the table, but the patient will ultimately make the final calls. There'll be quite a bit of testing done. We love it if patients can bring all their previous testing, because a lot of the pathology has been viewed by practitioners in a disease model, so looking for disease. We're looking at how the body's functioning, so same set of pathology, different interpretation. And from there, they will see a group of practitioners, and then there'll be a team meeting on Friday where all the clinicians sit around and we take the case to the table and we discuss it as a group of 18 practitioners. And so some practitioners may not even see this patient, but they'll understand different nuances of the case, suggest different testings, suggest different interpretations of testings, and then that'll be fed back to the client. So it's an organic process, no one size fits all. It's personalised medicine at its best. The team meetings are absolutely essential for the integrative process to work. That's one thing. And